Joining me now from France is Chris Dye. He's a professor of epidemiology at Oxford University. Great to have you with us. I'm curious if you can walk us through what's going on here. Is the rising number of COVID cases happening because of waning immunity from vaccinations, plus not enough people being vaccinated? Talk me through what the reasons that you're seeing for this spike in cases.
Yeah, hello. Both of the things that you've mentioned are important. Waning immunity, vaccination coverage is high, but not yet high enough. And we're going into a winter period where people spend more time indoors. They spend more time in close association with each other. And all of that is leading to higher rates of transmission. What we're learning from this is that despite high vaccination coverage, we need to push vaccination rates even higher, and we need to combine that with other measures such as masks, hand sanitizer, COVID passes, working from home where possible, and other measures, because that's what it's going to take to keep COVID down this winter.
Have we gotten too relaxed with these social distancing measures, with the masks, with, keeping our distance from each other as the pandemic has carried on?
Yes, there's obviously been a tendency to do that, and the regulations suggested by governments to populations have varied from one country to another in Western Europe. And we've seen in France, where I live, in Italy and in Spain, where the regulations are tighter and where vaccination rates are higher, then the number of cases, the number of hospitalizations, and the number of deaths have stayed low. And that very strongly suggests that when we put all of these measures in place, we can avoid nationwide lockdowns. And that's really what we're trying to avoid at the moment going into this winter. So the turn of events that you've just commented on, announced Netherlands, Austria, and other countries where partial lockdowns are now being put in place is really undesirable. And I think nobody wants to see that on a large scale across Western Europe.
Let me go back to one thing that we talked about earlier, that's waning immunity. So this is inevitable for those of us who get vaccinated, that, the antibodies, the immunity is going to get less and less as time goes on. Do you see having boosters become a mandate, whether it's by corporate America, companies and countries, and not just Europe overall, but in the U.S. as well? Do you see boosters being mandated, and should they?
In the first instance, I see boosters being recommended and a stronger consensus being developed on boosters being used widely. The time at which they're used, 6 months after the first bout of vaccination, after people have been double jabbed, 6 months is what's being recommended at the moment. And I think in the first instance, what will happen is that people will be encouraged to get a booster. Mandates are undesirable, but they may be necessary under some circumstances and for certain categories of people, as we have seen for the first round of vaccination.
This spike in the number of cases that we are seeing in Europe widely, are we expected to see the same thing happen here in the U.S., especially as we get closer to the winter months when we're indoors more?
I think it's likely, what we're seeing in Europe at the moment is likely to happen wherever the same pattern of events is repeated. And therefore, yes, in parts of the United States in the winter months. But I want to emphasize what's happening in France, Italy, and Spain at the moment, where vaccination rates are high and getting higher, and where additional measures are taken seriously, such as the use of COVID passes, masks, sanitizers, and so forth, that under those circumstances, it's possible to keep COVID under control, at least so far. So I think that's positive news from these parts of Europe. But where all of those measures are not used, we're very likely in the winter months to see a rise in cases.
Okay, we have to all stay vigilant. Chris Dye, thanks so much for your expertise.